Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder. I am also the best-selling author of the books All Rise, The Sickle Cell Community versus the Medical Establishment, and A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. These days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. Hello, everyone. I hope you guys are having a great week. So, today we are going to talk about transfusions and specifically transfusions problems and solutions in sickle cell disorder. So the reason I picked this topic is because recently a lot of people have been messaging me about complications from transfusions and not knowing what to do with it, with those complications, what to do with those problems. And when I start hearing the same types of things repeatedly, that's when I make a video, because I realize that it's a topic that's going to come up over and over again, and there's one of me and many of you, so this is a great way to kind of say everything I want to say on the topic that's relevant to us anyway, and then you can always access that information either for yourself or even for your provider. You can show them the video. Okay. All right. So first I'm going to start with, what do you do emergently if you are in the hospital and your blood count is super low, but they're saying you can't be, transfused. They're saying that you are, let's say you have a history of transfusion reactions. Okay, let's start with that first. So transfusion reactions usually indicate that the major antibodies may have been taken care of, like your typing, like it's been, you have your blood type A, B, AB, and O, and then you have RH factor, it's called, and that makes you positive or negative. So you can be A positive, negative, like that. And a lot of times you can have those all matched up and even have certain big antibodies matched up, but you might have some tiny lesser antibodies on the surface of your cells, and that's not matching up, and you can get a transfusion reaction because of that. And sometimes it's delayed, and you start getting febrile, and then you can go to the bathroom to urinate, and it could look like Coca-Cola in the bowl. And I say that because I've had a personal experience with a delayed transfusion reaction, right? So what are some things that can be done to prevent that? First of all, non-emergently, you would create a situation that's optimal for you, because really what that delayed transfusion is saying is that you're likely getting Caucasian blood or blood from another ancestral line and not from people from African descent. And so all of those little tiny antibodies that are supposed to match up aren't matching up, because as we go from ethnicity to ethnicity, from one ancestral line to another, those antibodies vary. And so when you are getting a transfusion, if it's just a one-time thing, or maybe once or twice in your life, no problem. But if you're going to get recurrent blood transfusions, there is going to be a problem. And so you need people of African American descent to donate blood for you. Now, what would that look like for you? In some countries, it would simply be asking all your family members and friends to come in and donate a unit of blood. In the United States, when African Americans donate blood, it automatically gets screened for sickle cell compatibility with some patient. And the reason for that is that sickle cell disorder is the largest genetic disorder, right? So there is a priority that's placed on that because they know that these patients are going to need recurrent transfusions, and they're going to need to be matched really closely with the same ancestral line of blood. So if an African American person comes in, that would be the first priority, right? And then if there's not a match, or if there's not anything that they could do with that unit of blood specifically for the sickle cell population, then it goes into the general population. So you can actually ask your friends and neighbors and family members that are of African American descent to come in and donate a unit of blood, because that will increase your chances of getting a properly matched unit of blood, or units of blood, because in the case of exchange transfusions, it's usually, it could be up to 10 units of blood and more. So you would have a higher chance of having all those units be properly matched, right? So that's the first thing, is just having a better matched blood. But that's not something that you could do emergently. Emergently, what you can do is to pre-treat the patient. So what I discovered a long time ago was that you could actually pre-treat with steroids. So if you give a certain dosage of steroids, with me it's usually 60 units of Solumedrol, and I do that 30 minutes before my transfusion, along with 50 of Benadryl, and they're both IV, and that's done 30 minutes prior to the transfusion. So once I start getting transfused, that's already, my system is already prepped, and really what it's doing is saying, please, immune system, this person needs this blood, and I know that you're doing a wonderful job of attacking anything foreign, but this is a foreign thing that they actually need. So please accept it. Please allow the system to accept it. And so that's what one of the things you can do emergently. Another that I have recently found out is permitted according to the ASH guidelines, is a medication called Rituximab. So Rituximab is actually a treatment that's used in immunosuppressive disorders usually, and sometimes even in rheumatoid arthritis, and it can be used also in certain cancers. But it's basically to suppress the immune system temporarily, to say, let the body accept this foreign substance because they need it. And so in our case, that's what it would be for people with rheumatoid arthritis, for example. They're basically getting it to suppress the immune system so that they don't create autoantibodies towards their own bodies. And that's what rheumatoid arthritis is you're creating autoantibodies, right? And it's causing problems in your joints and things like that. So it's the same mechanism. It's the same thing that we want it to do, is to suppress the immune system just temporarily. But what we need that for is for it to allow the blood that we need to come in and to serve our bodies. Okay, so that's something that you can also do besides the steroids and the Benadryl preparation. You can also do the Rituximab. Okay, there are cases where doctors don't want to treat because of iron overload, and so they're going to introduce things like Desferal and Xjade and things like that for chelation. And this is not, obviously, this is after you've gotten a lot of blood and you you've had accumulation of iron in your body, and now you're at risk for more blood transfusions because they're afraid of what that extra iron will do to your body, to your organs, to your liver and such, right? So they will then introduce things like X-Jade and Desferal. And for people who want to consider a more holistic approach, I have, gone to holistic providers who've actually done EDTA. EDTA is a substance that they actually use very regularly in the labs, in the tubes. When they collect blood, there's a little bit of EDTA in the bottom of that vial to make the blood stay fresh, basically. But EDTA is also a chelator, and it will bind to your iron in your body, and then it can be eliminated by the kidneys, right? And so, and essentially that's the same thing that X-Jade and Desferal are doing. It's just that the EDTA tends to have a lower side effect profile, and so people who are of holistic bent are usually wanting to do that, but it's not always available in your area, right? Because the holistic providers are kind of, it's not very regulated, not as regulated as the conventional medicine industry. And that's because they've been suppressed, really. But it may not always be available in your area. And so the other thing to consider is exchange transfusions. So you want to basically, instead of adding more iron to your body, your doctor would then give you a red cell exchange. And what that means is, for how many ever units of red blood cells you have that are sickled, you would get the same amount donated to you, right? And you would be able to then not have any increased iron, but you would still have an increase in your oxygen capacity, because now you have normal red blood cells that have a higher capacity to carry oxygen and nourish your body. And so even though you may have the same level of hemoglobin when you're done, it's working at a higher capacity. It's working like on 100%, right? And it's not blocking your circulation or causing hypoxia or low oxygen anywhere. It's flexible cells that are able to go anywhere and nourish your body. But because you got the same amount given to you, you didn't get any extra iron, and so you're not at risk for iron overload. So one of the things that can be done for people who need chronic transfusion therapy is exchange transfusion versus the straight transfusion, because the exchange transfusion doesn't give you, that extra iron that puts you at risk for iron overload. Okay, so the third situation that people can find themselves in is if and I forgot to mention with the EDTA with the X-Jade and the Desferal. I didn't go into those because that's not the purpose of this video, but I will go into them in another video, okay? All right, so the third situation you can find yourself in is if someone has a high antibody count, right? So it's not just that your minor antibodies are acting up and causing a delayed transfusion reaction. You just have way too many antibodies for a transfusion to be considered safe. And so that's one of the reasons why I am excited about one of our newer treatments called Voxelotor or OxBrighter. Actually, they're calling it OxBrighter now. And and that is made by Global Blood Therapeutics. And essentially, what that does is that it allows for your own hemoglobin to bind preferentially to oxygen in such a way that it's always in the oxygenated state, and in the oxygenated state it doesn't sickle. In the oxygenated state it doesn't break down as much, so you're not getting as much anemia because it's not breaking down as much. And it is they've actually done studies to show that it actually increases your hemoglobin count. I imagine simply because you're not getting that chronic blood breakdown, and it's actually allowing your bone marrow to create more and more red blood cells without breaking them down so fast, right? And so that's something that wouldn't put you at risk because of having new blood products in your body. It's your own blood, that's your own hemoglobin that's being increased. So that's one great way of doing it. Now there are natural ways, obviously, of increasing your blood count. I remember having to take beets and roots that have a lot of minerals. A lot of roots have high content of minerals. So when I say roots, I'm talking about your yams. Some of them are called edos. I don't know, probably from country to country they're called a different thing. There's one root called Malanga here that I grew up calling dasheen in my country of Guyana. And when you boil it, it actually looks white like a potato, but it has these like purple stippled, like purple dots all over, just stippled in purple dots. And but that thing is high in mineral content, and people just knew, like the older folks just knew that that was the thing to give you when you needed to build your blood. And so I ate a lot of that. I still do actually eat a lot of that to build blood. And you can also use things that are high in iron. When you take foods that are high in iron, it's better than an iron supplement. Obviously, if you have iron overload, you want to thread cautiously, but if it's for a high antibody count, you can eat foods that are high in iron and B12 and folate like folic acid. Oftentimes we take a folic acid supplement, but you can also eat foods that would be beneficial to you, right? And then the last thing is something called erythropoietin, and that is a hormone that's made by the kidney naturally, and that hormone then stimulates the bone marrow. Whenever there's a low oxygen tension in the body, it is triggered and it stimulates the bone marrow to make more red blood cells, right? The body is just amazing. And so if you are having a situation where you can't get transfused, and because you have a high antibody count, that's one of the options, is using the exogenously made or synthetic made EPO. And it is an injection, and it's given to you, and it stimulates your bone marrow to produce more red blood cells. And that is one way, at least emergently, until you can come home and adjust your diet and things like that. That is one way that you can actually get more red blood cells. Essentially what you're needing is more red blood cells that can carry more oxygen to your circulation and nutrients, right? And so that can fulfill that role emergently until you can get something else. I hope that this was beneficial, and thank you so much for watching, and I'll see you next time. Take good care. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you benefited from this episode any at all, please like on the video, subscribe to the channel, and share the video with one other person as your good deed towards the sickle cell cause. Have a great day. If you would like to contact me to speak in your area, please don't hesitate to email me at drsimonesays@gmail.com. If you are the one referring me, please let me know so that I could send you a nice thank you surprise.